Overnight we've had the first half of 97,000 new testing kits arrive. We've now completed 81,000 tests in Australia for a 0.5% positive rate, which means that 99.5% of people who've been tested have been negative. What that means is we have had one of the highest rates of testing of any country in the world. These new kits are very important to make sure that we have the continuity and we have plans to continue that process. We do say the focus should rightly be on the vulnerable and those that are at risk, those that have been travelling overseas, those that have been in contact with a known case and have symptoms. And I think this is a very important thing. One of the highest rates of testing in the world, 81,000 completed and 97,000 new kits, the first half of which landed by plane in Australia overnight.
Does this mean you can now relax the guidelines about who can be tested and actually expand this testing regime to people who are once, perhaps twice removed?
No, we want to continue to focus on the highest risk cases, and I think it's important for Australians to understand that 99.5% of those tested have been negative, which means that, of course, focusing on the contact cases, the people who've travelled from overseas and have symptoms, gives us the best chance of finding those that have actually contracted the coronavirus. If we're testing those that are multiple levels removed, then we're taking the focus away from those that are most at risk. Our goal here is to protect the vulnerable, the elderly, those who have respiratory conditions. And if we can do that, we can save lives and protect lives. And so we've worked very hard to get these tests conducted, very hard to get these tests brought in, and we'll continue to be able to make sure that we're giving that support. It puts us at the absolute global forefront.
There's not an insignificant amount of Australians, though, that do have coronavirus and are showing very vague symptoms of this. How are you testing individuals that may have come into contact with these people? Are you concerned about that at all, particularly when it comes to children?
What we know is that with children they are far less likely to contract the virus than others, and the advice from the chief medical officers is they are less likely to contract this virus than the flu, for example, and if they are affected, it is far more likely to be mild. More generally, we know that the older you get, both the higher transmissibility and the higher impact, and so we are focusing on what's called contact tracing, where somebody has been diagnosed to reach out to everybody that we know they've been in contact with. They become high priority, and this was how we were able to buy Australia the extra month or 6 weeks ahead of other countries and delay the onset, which has given us the chance to both ramp up the testing, to prepare the hospitals, and to be able to put in place the regimes around Australia that are assisting people. And over 80% of people who actually contract the virus have very mild symptoms.
What is the latest advice on social distancing? Is 1.5 metres enough?
Correct. So the Chief Health and Medical Officers have met, so the finest group of medical officers in the country, based off the expert virologists or contagious disease experts who themselves have been meeting. They've reaffirmed that they're looking for that space around people of 1.5 metres wherever possible. Obviously in family groups that's a different situation, and trying to minimise contact, to not be touching other people in the usual way with handshakes and so forth. This is a unique period we're going into for 6 months, and in the same time, if you can be providing food, doing the shopping for neighbours who might be in isolation, particularly for the elderly and the vulnerable, that's the human thing to do, the Australian thing to do, to make way for them in the shopping aisles, to give them that support, remembering our best selves. This is about health protection, but it's also about making sure that as a country we face a condition that we've not known before, but if we show that spirit of caring for each other, we'll get through this.
Can I ask you about this limit to indoor activity? 100 or less, gatherings limited to 100 or less. Has a decision been made on that? Has that been recommended?
So the National Cabinet of the Prime Minister and the Premiers met last night to consider the advice of all of the Chief Health Officers. I understand those details are being finalised as we speak, and the Prime Minister will be making a statement early this morning. I'll let them complete that work, but there will be new restrictions on indoor gatherings, but the final details are being settled now between the Prime Minister and the Premiers after meeting late into the night.
Should we brace for limited spaces or limits in pubs, clubs, restaurants, potentially even gyms?
The advice of the Chief Medical Officers was that those operations and activities can and should be able to continue, but with increased limits on the number of people who are in an indoor gathering and increased practicing of exactly what you asked me about in terms of the distancing between people. And so with that medical advice, which we think is not just the best in Australia, but in my view, the best in the world, given that our epidemiologists, our virologists, our communicable disease experts help lead the world. They're leading the world on vaccines, and I spoke with the Doherty Institute and the University of Queensland yesterday on this, and they're leading the world on treatments to help minimise the impact of coronavirus, particularly on our vulnerable, particularly on those with respiratory conditions.
Just one final question. There was a bit of concern around this morning, if you could clear this up for us. DFAT, through the government essentially, is telling Australians overseas to perhaps consider coming home now. There was some concern that this might be a precursor to Australia shutting its borders completely. Can you tell us anything about that?
I can. Our concern has been that people will be stranded for commercial reasons, and overseas we cannot guarantee the medical treatment that they would get if they are sick, and we know that there is a risk that other countries for commercial reasons or otherwise may not have flights continuing. So we want to give Australians the best chance to come home, and we think that the safest place for them is in Australia, and that's an important step forward.
So this is not a precursor to Australia shutting its borders. It was more a practical commercial airlines reason. Is that correct?
It is a practical action. The other thing, though, is we have imposed a universal self-isolation, whether it's Australian citizens or others who come to Australia, 14 days if you arrive back in Australia in self-isolation, and that's the way that we are protecting Australians in Australia, to make sure that anybody who comes in is removed from general association in the community for 14 days. That's the period of incubation for the coronavirus. Generally it's considered to be less than 14, but 14 is the precautionary period. So we protect Australians in Australia with universal self-isolation, and those Australians abroad, we do want them to come home as much as possible, because otherwise they risk being stranded, and we cannot guarantee the medical conditions or the social conditions overseas. But ultimately our goal is to protect the vulnerable, to protect the country, and the items that the unique, historic National Cabinet, which the Prime Minister and the Premiers have established, further measures coming this morning.
And is that why all major domestic events for ANZAC Day have now been cancelled?
Well, this is the mass gatherings rule, which was put in place last Friday, now being applied to forward events, and that's being done again to limit the possibility of the spread. But we all have a role in this. This idea of helping to stop the spread, yes, it's governments, but it's also businesses, and it's each individual and community. If we can work together to help stop the spread in terms of practical action, taking care of the vulnerable, supporting each other, common sense around hygiene, limiting those gatherings to what's necessary and keeping within the rules, then that's going to help us what's called flatten the curve, which means reduce the numbers, spread the load, and protect our beautiful elderly.